We'll talk about an important topic related to liver disease, and to be more precise, related to the association between liver disease and lung disease, or what we call the hepatopulmonary link, or the hepatopulmonary relationship, or the lung-liver link. And I have already spoken about this topic in my clinical lecture series, which I presented in the year 2022. But to continue, because I just give a general idea or general information about the configuration of the liver and the lungs in clinical practice or in disease. And I have already mentioned that the association between the liver and the lung in the same patient may be going in one of three ways. It either starts in the lungs and then be complicated with liver complications or liver involvement or hepatic involvement, or it starts the vice versa, or العكس يعني, it starts in the liver and be complicated by pulmonary complications or pulmonary involvement or pulmonary manifestations, or the pathological process starts in both the liver and lung simultaneously, or in consequence with some time interval between the both involvement of the liver and the kidney, but the pathological process causing the disease is the same, and this is called simultaneous hepatic and pulmonary involvement by the same process. Or the primary may be in the liver and then the secondary problem is in the liver, or the primary is in the liver and the secondary problem is in the lung. This is the three ways of how is the liver and lung are associated or they are involved together in clinical practice or in disease, whether at the same time regarding the course or sequentially, that is, one developing after the other in the natural history of the disease, as we all know, or as it is the biological nature of the disease causing both hepatic and pulmonary manifestations or involvement. Today I will, and I have mentioned that it is a very broad spectrum. It is a book by itself. To talk about the lung and liver, we can give many lectures about this, because each one of these, the three processes or the three methods of involvement of the liver and lung together needs a series of lectures. When the disease starts in the lung and then complicated by hepatic complications, or the disease starts in the liver and then be complicated by pulmonary complications or pulmonary involvement or pulmonary manifestations or manifestations of involvement of the lung as a result of liver disease, or the process affects both the lungs and liver together, whether simultaneously at the same time or sequentially, that is, one developing and then shortly after the other will develop in the other organ. I have mentioned, for example, the pulmonary complications of liver cirrhosis as a secondary involvement of the lung due to primary liver disease or primary liver pathology. And the most common is liver cirrhosis, because liver cirrhosis is the commonest example of advanced liver disease, as we all know. So the pulmonary complications of liver cirrhosis is one of the most common examples or most popular examples of how does the liver affect the lungs, or how does liver disease affects the lung. Again, it is exemplified by the pulmonary complications of liver cirrhosis or pulmonary manifestations of chronic liver disease in another way. But tonight I want also to lay stress on an important topic, which is what is the difference, because I didn't talk about it much when I was talking in the year 2022 about the lung-liver link or the lung-liver relationship or the hepatopulmonary relationship in practice. This topic is related to what we call the hepatopulmonary syndrome and the portopulmonary syndrome. these two important syndromes linking the liver and the lungs. Again, what is the difference between hepatopulmonary syndrome and between a portopulmonary syndrome, or more formally called portopulmonary hypertension? But let me first speak about that the famous clinical issue, which is the relation between liver cirrhosis and important dysfunction of two important organs or vital organs in the body, which are the kidney on one hand and the lung on the other hand. The relation between chronic liver disease and renal dysfunction, and this is what we call hepatorenal syndrome, and the relation between, on one hand, and on the other hand, the relation between chronic liver disease, that's liver cirrhosis, and chronic liver failure with the development of pulmonary manifestations or complications, and this is what we call the hepatopulmonary syndrome. So we have two important syndromes related to chronic liver disease and liver cell dysfunction or failure. These are the hepatorenal syndrome and the hepatopulmonary syndrome. These are two important different clinical entities. About the hepatorenal syndrome, I have already spoken about it in one of my lectures in 2022, and I was speaking about the link between the liver and the kidney, which is a very important link in clinical practice, or diseases, or the disease processes which might affect the liver and the kidney, whether starting in the liver and then complicated by renal problems or renal complications, or vice versa, that is the starting in the kidney and then as a primary kidney disease and then complicated by secondary hepatic involvement, or again as a simultaneous involvement or both kidney and liver together. But let me today shift to the other issue, which is the hepatopulmonary, which is different from the hepatorenal, the hepatopulmonary. And here we have two entities. The hepatopulmonary syndrome is important clinical entity, and another different entity, which is different clinically and pathologically. The clinico-pathological features are different, which is the portopulmonary syndrome, the portopulmonary syndrome, or more formally called the portopulmonary hypertension. The two conditions, the hepatopulmonary syndrome and the portopulmonary syndrome, which are, as I mentioned, different clinically and pathologically, they have a common factor or a common denominator between them, which is the presence of portal hypertension. And both conditions, they occur in the setting of advanced liver disease. Although there is a small percentage of portopulmonary hypertension or portopulmonary syndrome cases which have portal hypertension, but there is no evidence of advanced liver cirrhosis, or to be more precise, there is no cirrhosis. But there is portopulmonary hypertension. This ratio of, or percentage of patients is in the range of 5 to 7, or in some other reports, 5 to 10% of cases. But most of them, they have portal hypertension, complicated, evident advanced liver disease, most commonly liver cirrhosis. Because we all know that liver cirrhosis either complicated by hypertension or complicated by liver cell failure, or the two conditions. Although the portal hypertension is more in diseases associated with hepatic fibrosis, while liver cell failure is more in patients with liver cirrhosis, because we all know pathologically there is a difference between liver fibrosis and liver cirrhosis. So this is the common factor or the common denominator. العامل المشترك بين الهepatopulmonary syndrome والportopulmonary hypertension or portopulmonary syndrome هو the presence of portal hypertension. But what is the difference between the two? To be more precise and to the point, hepatopulmonary syndrome, or the HBS, it has a triad, three things. These are the presence of, number one, advanced liver disease, most commonly liver cirrhosis, because we all know that the advanced liver disease is, or the most common forms of chronic liver disease are cirrhosis, chronic hepatitis, or of course, in the natural history of evolution of liver disease, it starts with acute liver disease and then passes into or acute hepatitis and passes into chronic hepatitis and then cirrhosis at the end, and then the liver cell failure or hepatocellular failure, plus or minus portal hypertension. Because, as I mentioned, portal hypertension is more in patients with hepatic fibrosis, like bilharzia hepatic fibrosis, for example. Any pathology causing periportal fibrosis will present with portal hypertension rather than liver cell failure. And cirrhosis present with liver cell failure as the utmost ultimate complication rather than portal hypertension. But both may happen in patients with chronic liver disease. So, in hepatopulmonary syndrome, there is triad is advanced liver disease. Number 2, intrapulmonary vascular dilatation. And number 3, low arterial oxygen saturation or low PaO2. That is the arterial saturation is low. And the patient presents with commonly pulmonary symptoms of shortness of breath and maybe some cyanosis, maybe chest discomfort, but the most common pulmonary symptom is shortness of breath, dyspnea. Whether dyspnea on effort at first and later on may present with dyspnea at rest in advanced cases of hepatopulmonary syndrome. But the commonest feature is shortness of breathing and low arterial oxygen tension as presenting clinical symptoms and as an abnormality in arterial blood gases. So the triad of hepatopulmonary syndrome or HBS is advanced liver disease, intrapulmonary vascular dilatation, and low arterial oxygen saturation. This is the triad. Let me focus on the important issue, which is intrapulmonary vascular dilatation. There is inside the lungs dilatation of the small pulmonary vessels, namely small arterioles and capillaries. And there may be some sort of or what we call arteriovenous shunts opening inside the pulmonary circulation or in the pulmonary circuit, and this may also cause the cyanosis, the opening of pulmonary arteriovenous shunts due to the presence of metabolites which are vasodilator metabolites, which are normally metabolized by the liver, but since the liver is failing or unable to metabolize due to the chronic liver disease, due to the cirrhosis, due to the liver cell failure, the liver is unable to do its normal metabolic and excretory functions, which I mentioned before, the functions of the liver or the normal physiology of the liver, synthesis, metabolism, and excretion. So the diseased liver is unable to do the metabolic function, the excretory function, so the metabolites, which are normally, and these metabolites are vasodilator metabolites, and these are many chemically, and these are released into the arterial circulation. It goes into the venous stream, and then it goes through the portal veins into the inferior vena cava, and then goes to the right side of the heart, and then to the pulmonary circulation as the normal arterial circulation from the liver to the lungs, and then reaches and causes this pathology inside the lungs that is intrapulmonary vascular dilatation. And this intrapulmonary vascular dilatation will be one of the main issues or triad in the hepatopulmonary syndrome. So there is intrapulmonary vascular dilatation, capillary dilatation, some sort of shunts, and will cause the pulmonary symptoms of dyspnea or shortness of breathing and the low arterial oxygen saturation. This is hepatopulmonary syndrome. Let me shift to the portopulmonary syndrome. The portopulmonary syndrome or the portopulmonary hypertension, as it is more formally called, it is elevation of the pulmonary blood pressure in patients with portal hypertension. So the pathology starts with portal hypertension, that is elevation of pressure inside the portal venous system of the liver. In the portal venous system of the liver, we all know that the liver has two venous systems, the portal venous system and the systemic hepatic venous system. The portal venous brings the blood from the GI, the gut, to the liver for metabolism of nutrients and gastrointestinal materials, which are have gone through digestion and absorption and then reach to the liver for metabolism, as we all know. So This is through the portal circulation. This is the portal venous circulation. But there is another venous circulation, but this exiting the liver through the hepatic venous system or the hepatic veins, which drain into the, as we all know anatomically, into the inferior vena cava and then reach the right side of the heart. So there is here elevation of pressure in the portal veins. And then this elevation of pressure gets complicated by elevation of pressure in the pulmonary vasculature or in the pulmonary circulation due to what we call pulmonary arterial vasoconstriction. So here there is pulmonary arterial vasoconstriction and what we call vascular remodeling of the pulmonary arteries and vascular remodeling of the pulmonary arteries, especially the small pulmonary arteries anatomically or anatomopathologically. The pathology affects specifically the small arteries and arterioles and capillaries of the pulmonary circulation. This causes the pulmonary hypertension. So there is pulmonary vasoconstriction and there is vascular remodeling of the pulmonary arteries, especially the small arteries, arterioles, and capillaries, as I mentioned. So this is where is the pathology in patients with. That's why we usually diagnose this condition of portopulmonary. The first diagnostic tool is to do transthoracic echocardiography to detect the pulmonary hypertension and to detect the right side affection or the right ventricular remodeling and the right ventricular enlargement. And number two is by doing right heart catheterization and measuring the pulmonary blood pressure. So, but first, the first tool is transthoracic echocardiography, the usual Doppler echocardiography to diagnose hypertension and right-sided enlargement or hypertrophy. That is right ventricular, because this later on ends with right ventricular hypertrophy and then right side heart failure, congestive heart failure at the end. Here there is portal pulmonary hypertension complicated the portal hypertension. So this is the difference here is that the pulmonary vasculature there is vasoconstriction and there is vascular remodeling of the pulmonary arteries in patients with portopulmonary hypertension. And the patient presents with shortness of breathing, in addition to the other complications of pulmonary hypertension. So this is what we call the portopulmonary hypertension. As we see, there is the clinical pathological features of the two conditions, that is the hepatopulmonary syndrome on one hand and the portopulmonary syndrome or the portopulmonary hypertension on the other hand. They are different, the clinical pathological features. And the clinicians should know how to differentiate between the two conditions, not to confuse them together. Because both conditions, they have portal hypertension in common, that both conditions, although both conditions are associated with portal hypertension, but there is differences between the two, as I mentioned. The hepatopulmonary hypertension is associated with pulmonary hypertension and vascular remodeling of the pulmonary arteries and pulmonary vasoconstriction, and this is very important. Pulmonary arteriolar vasoconstriction, this is in portopulmonary syndrome, while in the hepatopulmonary syndrome there is intravascular pulmonary dilatation and there is low arterial oxygenation in patients with advanced liver disease, always in patients with advanced liver disease in the hepatopulmonary syndrome. But in portopulmonary, although the advanced liver disease is present in most of the cases and as the cause or the underlying cause of portal hypertension, which will cause pulmonary hypertension, there is small percentage which doesn't have or who don't have evidence of liver cirrhosis, for example. As I mentioned, 5 to 10% in patients with portopulmonary hypertension, there is no clear cirrhosis or chronic liver disease in those patients. This is very important to differentiate clinically, although again, the two conditions might be present in the same patient at some point in the natural history of the disease, that is the chronic liver disease. They will develop the condition sequentially in time. There is time interval between them. They usually don't appear together at the same time, but they may develop. So when we follow up cases with chronic liver disease, we must be aware of how to detect early and to treat early patients with hepatopulmonary syndrome, and on the other hand, patients with portopulmonary syndrome, because the patients with portopulmonary syndrome need special attention, and to prevent especially the presence of the pulmonary hypertension, for example, in such cases, which needs special attention, needs special treatment in order to avoid the complications, because when the patient reaches severe degree of pulmonary hypertension, it might be a contraindication to future liver transplant, because many of those cases with end-stage liver disease or chronic liver disease or end-stage cirrhosis, they might need liver transplant. If they have complicated or they have complication of portopulmonary hypertension, pulmonary hypertension has reached to a severe degree, it might be a clinical contraindication to successful hepatic transplantation. So that's why we have to treat this pulmonary hypertension early while awaiting for liver transplant, for example, in such cases. This is very important, and in order to minimize any future complications. And we have to observe the difference between hepatopulmonary syndrome, again, on one hand, and the portopulmonary syndrome or portopulmonary hypertension on the other hand. Thank you so much, and I hope to meet again in. This is a very important reminder. The clinician should not forget this. They should detect the two conditions, and they should be able to differentiate between the two conditions pathologically and clinically, and know the clinico-pathological distinction between hepatopulmonary syndrome on one hand and the portopulmonary syndrome on the other hand. Thank you so much, and my best wishes to all of you. Professor Tarek Ali.